Hello, we're answering questions on health and medical problems. I'm joined by Dr. Rosemary Leonard. Hello, Rosemary.
Hello.
We've got a question here. Now, I don't know whether it's from a man or a woman, and it's about hair loss. This person says, whilst I was combing my hair the other day, I managed to dislodge a small clump of hair from my scalp. Now, initially I dismissed it, but the following day the same thing happened again, and I've started to wear a cap. Sounds a bit like a man, doesn't it?
Yes.
When I go out, because I'm worried about it happening in public. I'm only 26, but does this mean I'm going bald?
Well, it may be that he's going bald if it is a man, but he needs to look at his family history, because male pattern baldness, certainly starting at this sort of young age, tends to run in families. So if your father went bald or your grandfather went bald...
Got a great clue there, then.
Yes, you've got a great clue that it might be. The other thing it might be is a condition called alopecia areata, which is what we call an autoimmune condition, where you develop antibodies against your own hair follicles. It can happen out of the blue, and unlike male pattern baldness, which happens on the top of the head and the temples, alopecia areata can occur in any part of your head. So you could get an odd patch at the back, an odd patch at the front. Sometimes you just get odd patches the size of a coin, but you can get it so it covers the whole scalp.
So could you lose your eyebrows and your eyelashes if it was in an extreme form?
In an extreme form, yes, that can happen. Quite often with these types of alopecia, the hair does grow back. In a very few cases, it doesn't, but there are treatments you can try using, particularly strong steroids, if the condition appears to be progressing. The other thing always to do with hair loss, with both sexes, is to check the thyroid function, because if you have an underactive thyroid, it can cause hair loss, as also can low iron levels, which is a particular problem in menstruating women. If you just have, even if you're not anemic, if you have low iron levels, it can cause thinning hair, so they should be checked.
And if this were a woman and she was 26 and losing hair, she should be doing the same thing. Check her iron levels, check her family history. She'd probably know about that, though,
yes.
wouldn't she?
In women, it can also be related to a hormone imbalance, can cause hair loss in the male pattern distribution. So women who've got polycystic ovarian syndrome, where you have a slight hormone imbalance, can get hair loss on the temples and on the top of their hair. And the other thing I should say is hair loss can be related to stress. So,
yes,
if you are if you're very tired and working hard, have a look at your lifestyle as well, because it can affect every part of your body, including your crowning glory.
Very good advice. Thanks for that, Rosemary. Well, we hope that if you have a similar problem, we've offered you some help. But of course, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.